monkeypox MXP vaccine in Minnesota. 2 vaccines are currently authorized or approved in the U.S. to prevent MPX, Jynneos and ACAM 2000. Jynneos is currently being used internationally to address MPX. To best reach people who are at higher risk of MPX, we are working with a wide range of clinics, including health systems, local public health, sexual health clinics, tribal clinics, and clinics serving those experiencing homelessness. Providers are using the following strategies to use this limited vaccine. Post-exposure prophylaxis, PEP. Vaccinated people who know they had an exposure to MPX, PEP++. Provide vaccine to people who are at the highest risk for MPX, even if they don't know if they have had an exposure to MPX. Vaccine allocation. The amount of vaccines being provided to our state is limited. That means we need to prioritize people at highest risk of getting very sick from MPX and those most likely to have been recently in contact with someone with MPX. Right now, the vaccine is for people who do not have symptoms of MPX infection and have been exposed in the past 14 days to either someone who has been diagnosed with MPX infection or someone who has not received their test results back yet but has been told by their provider it is most likely a MPX infection. Engage in sex work or exchange sex for food, money, substances, shelter, etc. Not limited to MSM. Identify as gay, bisexual, or other men who have sex with men, MSM, and has had more than one partner in the past 90 days. Deemed at higher risk by a healthcare provider or public health recommendation. Priority will be given to people who identify as MSM and report any of the following: living with HIV, immune compromising condition, on or eligible for HIV pre-exposure prophylaxis, PrEP, deemed at a higher risk for MPX infection per clinical judgment of a healthcare provider or public health recommendation, treated for a sexually transmitted infection, STI, in the last 6 months, people experiencing homelessness, incarceration, or traveling to an area with community spread of MPX cases. Vaccine access. Providers with access to vaccine are reaching out to their patients who meet these eligibility criteria and offering vaccines. Providers are also assessing if their patients are eligible while patients are in for routine STI, HIV, PrEP care. Many healthcare providers and community clinics across Minnesota have received vaccines. If you are at highest risk and would like to get vaccinated, start by contacting your primary provider, public health clinic, community clinic, sexual health clinic, or tribal health clinic. Providers are continuing to stress practicing prevention measures even after vaccination. We expect more people will be able to get vaccinated as supply continues to increase.